I'm Lindsay Orosz. I'm the Director of Research at the National Spine Health Foundation, presenting our research in conjunction with the Virginia Spine Institute in Virginia of the United States. Nothing to disclose. So if you're treating adult spine patients, then osteoporosis is in your clinic. Preoperative bone mineral density assessment is essential, and postoperative bone-related complications can be devastating, like seen here in the animation. DEXA remains the gold standard, but often overestimates BMD in the degenerative population, which is the majority of adult spine patients. Preoperative CT scans, however, are becoming increasingly available, and opportunistic measurement of Hounsfield units is becoming increasingly popular. So the objective of this study was to determine if Hounsfield units less than 135 were associated with subsidence in the lumbar spine, and then also to compare the subsidence predictive performance between HUs and DEXA. This was a retrospective study of prospectively collected data at a multi-surgeon single center. Fusion cases were extracted from their thoracolumbar registry between 2019 and 2021. Patients were excluded if surgery extended above L1, if the fusion approach was not circumferential, if they were missing DEXA CTs or X-rays, and if follow-up was less than 1 year. After exclusion criteria were applied, 127 cases remained for analysis. So for the outcome measurements, X-rays were analyzed for subsidence at each postoperative time point up to 1 year using an automated computerized algorithm, and subsidence was defined as greater than or equal to 2 millimeters of decreased disc space height. DEXA was part of the preoperative routine at this center, so lowest T-scores were recorded overall and then of the spine region if that was scanned. And then those T-scores were classified according to the World Health Organization criteria. CT scans were used to measure Hounsfield units, opportunistic measurement of Hounsfield units at the L1 level using the mid-sagittal view. There are a few different methods. We use the mid-sagittal view. And just as a reminder, HUs less than 110 suggest osteoporosis. This is just a visual of the method for measuring subsidence. And this is the visual for 3 examples of measuring the Hounsfield units. And then if anyone hasn't measured this yet using your packs, let's see if this video will play. No, wait, let's see. There's a few buttons here. Well, the video won't play, but it takes about 3 seconds. In this CT scan, it's using the mid-sagittal view. So you line it up, use the ellipsis tool on your pack system. Oh, there we go. Thank you to whoever did that. You select the ellipsis tool. You mark the region of interest. In this study, we did use L1. And then you hit A, and the output appears. You get a min, a max, and a mean. So for the results, this sample had a median age of 60 years, and 46% were males. 2.4% had osteoporosis based on DEXA, but 44% had HUs less than 135, and 13% went on to subside. So we analyzed characteristics looking for associations with subsidence, and only age and Hounsfield units less than 135 were significantly associated with subsidence in the sample. DEXA was not. Logistic regression analyzed associations between predictors and the odds of subsidence. On the crude analysis, there was the odds of subsidence was 5.1 if HUs were less than 135, which remained significant on the adjusted analysis. This is just a scatter plot showing the difference between lowest T-scores in the lumbar spine on the y-axis compared to the lowest T-score of any other region on the same DEXA. And you can see that the lumbar spine is substantially and consistently higher on every measurement. And this is a case example that shows you that disagreement occurs when you least expect it. This is a 58-year-old male whose preoperative X-rays show standard degenerative changes, nothing excessive. His DEXA was normal, and they even calculated a FRAC score, which was normal. A CT scan was obtained for robotic planning, and Hounsfield units were measured, and they measured 76. And remember, osteoporosis is likely if HUs are less than 110. So the surgical plan changed. This patient underwent a belt and suspenders approach using BMP, multiple points of fixation, and subsidence did not occur at 1 year. So in conclusion, HUs less than 135 were associated with interbody subsidence in this study. And in fact, there was a 4 times more likelihood to develop subsidence when they were less than 135. Hounsfield units outperform DEXA as a subsidence predictor, and DEXA may not accurately be representing bone mineral density in the lumbar spine in your clinic in the degenerative population. Thank you.
Okay, thank you very much.